Okay, we're going to go ahead and get started with our next presenter. And this session is Managing Work in My Dialysis Treatments, and the speaker for today's session is Dr. Michael Byerly. Dr. Byerly is a practicing nephrologist in Little Rock, Arkansas. He is a University of South Dakota School of Medicine graduate and is board certified in internal medicine and nephrology. So let's please give him a warm welcome.
Thank you very much, and welcome to Little Rock again, all of you. I think for those of you on the East Coast, it's been a good transition down here, away from that weather, and of course anybody who's been in the South this summer realizes just how hot the South has been, and as you can tell, my two dogs have found a way to manage that by shades and lounge chair next to the pool. That's not what we're here to talk about. Managing work and dialysis, and what about maintaining your job? We know that studies have shown that patients on dialysis who work generally have a much better overall health than those who don't. Perhaps because a job gives them a good self-esteem, a sense about themselves, a place to go, and a purpose in life, makes them generally feel good. They also maintain good friendships at work, which can be very important as they go through this transition on dialysis. Those friends can come in quite handy at times. It also provides an income supporting the household. It also helps to maintain health insurance. But there are challenges. We'll discuss the options that's available to you, where to get the right information, and who to talk with. Choosing the dialysis modality is important, especially when you're trying to continue work. We'll talk a little bit about that, because certainly scheduling work along with your dialysis, and what about the rest of your life is very important. The rest of your life being your spouse, of course your family, leisure time, vacation time, and we want them not to conflict with them as best possible. Tips for continuing work: know your limitations. Understand what you're capable of doing at work, and what your work requires of you. Understand your body's symptoms of fatigue and weakness and tiredness. Share them with your dialysis team, share them with your physician. Oftentimes there are things that we as physicians in the dialysis team can do to help alleviate some of those symptoms, whether it's adjusting your medications, looking at your lab work, seeing what we can adjust to help in that regard. Certainly alleviate some of the symptoms. Know your options. Be sure and be open and honest with your employer and supervisor. Discuss with them the options of maybe working part-time or fewer hours when you start dialysis to allow your endurance to build up over time. Is there a possibility of changing your job description or your job responsibility? Can they be flexible in the scheduling with you? Can you work from home? Sometimes that's an option also. Is there a company short-term disability when you start dialysis, such that you can get that going first and then come back to full-time work? And what is the sick leave policy? Is that available to you also? Prepare your employer and prepare the co-workers is very important. Be sure and talk with your employer and supervisor about what's happening to you and what you're about to go through. Utilize a human resource department if that's available. They may help you recommend what to use to educate your coworkers as to what you're going through. You can provide educational materials or emails to your employer, supervisor, or coworkers. And you can get this information from this fabulous organization that we're here with today, the American Association of Kidney Patients. You can also get information from the National Kidney Foundation. And many states have a local kidney foundation where you can obtain information from. Also, the dialysis team, the dietitian, social worker, they're also there to help you get information that you need and make that transition to dialysis and to continue working. You can host a lunch for the employer and the coworkers, and a little question and answer session if you feel comfortable. And you can even ask your physician if you would participate in something, because I know there are some physicians willing to go out and help you if that's necessary. Continue to work hard, though, to meet the goals that you and your employer have agreed to. Adhere to any scheduling or work changes that you have agreed to so that they understand that you're working hard and they're working hard with you. Know your rights. The American Disabilities Act, Titles 1 and 5, states that employers with over 15 employees have to accommodate employees with disabilities. But they need sufficient information about your disability before they can make those accommodations. That doesn't mean you have to totally disclose the disability if you don't want to, but I think the more information they have, the better they can work with you to make the changes necessary. You may have to complete a health form if a job is offered, and be open and honest with that. You may have to take a drug test, and for some patients on dialysis, if they don't make urine, you may have to provide a blood sample or even a hair sample for that testing. You can also look at the Family Medical Leave Act, especially when you're starting dialysis. Because you can, if the employer participates, you can obtain possible 12 weeks within a 12-month period away from the workplace while you're initiating your dialysis therapy. It's a form that you pick up from your employer. There's a part that the patient fills out, and you take that form to the physician, and there's a portion he fills out, and you take it back. It also allows times for your physician visits or your monthly dialysis visits. So it's an important form to look at and see if it's available to you. What about getting started? Well, it's important to be sure and talk with your nephrologist, ask questions, understand what your medical risks might be in the work or the job that you do, or what are the potential benefits. Which modality is best suitable for you and the type of work you do. Then there's a training program once you start dialysis, and most everybody knows about this, but if you start peritoneal dialysis, the training program is usually 1 to 2 weeks before you're back in the home doing dialysis yourself. For home hemodialysis, it's about 3 to 5 weeks of training. And again, this is where the Family Medical Leave Act will be of great help. You may be required to have a dialysis partner. More common with home hemodialysis, but also with peritoneal dialysis. It's usually a spouse, family member, a relative, but it can also be a friend. And they will also participate in the training program with you and learn exactly what you're learning. Preparing the home for dialysis in preparation, there will be a site visit by the dialysis team to review your home, the space necessary for supplies, also the space necessary for you to do the dialysis treatment, having a clean room, clean environment. There may be some necessary plumbing or electrical modifications that need to occur prior to starting perhaps home hemodialysis. Most peritoneal dialysis situations don't require modifications. I think it's becoming less and less with the new types of home hemodialysis machines we have also. They're becoming much more space-saving and not quite cumbersome in terms of plumbing and electrical. But that's something the dialysis team will go over with you at the time. About monitoring your care, there will be ongoing contact with the nephrologist and the dialysis team, the nurses, the dietitian, the social worker, as well as the home dialysis provider. And that can be on a daily basis by phone with the nurses and the dialysis staff. It can be frequently with the physician. Certainly when you're on home dialysis therapy, the dialysis provider typically provides a 24-hour service. So if you're having problems with the machine or your dialysis, there's an 800 number that you can call and talk with them to try and get around the problems that you may be having. In addition, most physicians have a 24-hour physician on call that you can certainly contact also. What about the cost of home dialysis therapy? Is it as efficient as in-center? It certainly is. The estimated annual cost for a dialysis patient's all their care in a year's time is about $7,000. That's hospitalizations, surgeries, medicines. The portion that is just strictly related to the dialysis is only about $19,000. So it is still very cost efficient, and there's a big push now in our country to go to home therapies, whether it be home hemodialysis or peritoneal dialysis. Certainly there are some patient requirements. Dexterity and vision is very important. To operate the equipment, complete the paperwork that's necessary, and order your supplies, and certainly perform the dialysis-related tasks of monitoring and recording your weight as well as your vital signs. Reading, writing is important because you have to be able to read the training manuals and again record information for the dialysis team. Home equipment, again, you need space. That will be determined by the dialysis provider and team. And very important is initiative and motivation on the patient's part to learn the proper techniques, how to operate the equipment, certainly to maintain a clean environment, and take responsibility for their care. More and more evidence is being presented now showing much better patient clinical outcomes for those patients who do home therapies. And there's actually good survival also, because these patients are very responsible. They have fewer hospitalizations. They're much more compliant with their treatments and their medications. And because of that, there's less mortality and a much better survival. This was taken about the 4th of July. We have a son who's at Camp Pendleton, San Diego, in Marine Boot Camp, and we needed to boost his spirits a little bit. As you can see, the one on the right sits at attention a little better than the one on the left, so we'll have to send the one on the left back to boot camp. Continuing on, what about initiation of dialysis? I kind of broke it just into two categories, emergent and elective. Emergent initiation of dialysis is usually when the patient is hospitalized, and it's most often hemodialysis because it allows a more rapid correction of the chemical abnormalities as well as improvement in the patient's clinical symptoms. What's unfortunate here is it's not the time spent to educate the patient and the family about their options. And these patients are often placed on hemodialysis and sent out to the inpatient hemodialysis center. And they're not given that opportunity to review the options that they might have, especially if they want to go back to work. So I think it's very important that the family and the patient later on talk with the nephrologist and go over with the nephrologist, hey, I want to keep working. What are my options in terms of dialysis therapies? Elective initiation of dialysis usually occurs when the patient has less than 10 to 15% kidney function. And there have been many talks here through this week about chronic kidney disease, knowing your numbers, knowing your stage, and I think that's very, very important. This allows you to work with your nephrologist and the dialysis team to look at the options available to you. I think more and more practices are presenting what we call pre-education to dialysis prior to initiation of dialysis, so that you can look at the options of peritoneal dialysis at home or home hemodialysis. It also allows the spouse and the family members to be a part of this, and they can help in the decision-making process too. The dialysis modalities, as most of you know, are the two types of dialysis modalities, hemodialysis and peritoneal. In regards to hemodialysis, there are several options. There should be several options, and the most common in America is in-center hemodialysis, where the patients come 3 times weekly at a scheduled time for 3 to 5 hours. And it's workable. There are dialysis facilities that run late in the day for patients that want to work daytime hours or come in the evening and get their dialysis. Certainly there are patients that like the early morning shift, get that out of the way, and then do the afternoon job. And so it's doable. In-center self-care hemodialysis, which I briefly mentioned, is similar to the in-center hemo 3 times a week, but the patient is trained to do their own dialysis. You come in, you take your vitals, you do weight, you set up your own machine, put all the tubing, equipment on it, put your own needles in the fistula, put yourself on the machine, you adjust the machine as you go through your treatment. The staff will drop the medicines, but you leave your own medicines, and at the end of the treatment, you take yourself off the machine, fold the sticks, and you tear down the machine at the end. This is a big push for this because this can help you transition to home hemodialysis. You're at this center, they can help answer those questions before you go into the home hemodialysis. In-center nocturnal hemodialysis is kind of taking hold here in America. That's where patients come in after hours, and they come into the dialysis center. They're on the machine for 6 to 8 hours while they're sleeping. Now the dialysis staff monitors them. It's kind of catching on around some of the bigger cities. It's a little gentler on the body because you're not running the blood flows as fast. You're not removing the fluid as quickly. So the patients, when they get out after this treatment, don't have that washed out feeling. They feel a little better. And benefits of doing dialysis at home? Well, there's a big push on preserving what we call residual kidney function. In patients who have progressed through the stages of kidney disease and are finally starting dialysis, they may still have 5 to 10% of their kidney function left. And even though that's not enough to keep them off dialysis, it still helps us, and it helps them. And so preserving that little bit of kidney function over time improves survival and decreases mortality. Peritoneal dialysis does a little better job than hemodialysis at preserving residual kidney function. Doing dialysis at home sometimes allows for a more flexible diet, and that's important to some patients. It allows for better control of fluids if you're doing dialysis on a daily basis. It allows for better regulation of your blood pressure and decrease in toxin buildup. There's the potential for fewer medications. If you've got good blood pressure control, you may not need any blood pressure medicines. A lot of patients like that, not just because they're taking fewer pills, but it's less expensive too. Lastly, the home dialysis gives you the flexibility to fit your treatment times into your work schedule, and that's very important also. These are pictures of a couple of home dialysis machines. The one on the right is kind of a classic typical hemodialysis machine. The one on the left is one of the newer machines now that we're using. It's actually one of them that was over here in the hall that you could look at. As you can see, it's much smaller, much more compact, easier to use, and I don't think it requires near the electrical or plumbing modifications that the machine on the right used to require. It's all self-contained, has a cartridge that you put into the machine, and when you're done with your treatment, you take all that out, you discard that. It sits on a little table, almost like a little nightstand, so that it's right next to your chair when you watch TV or eat, or however you want to do that. And it's a really unique and a good machine, I think, to use at this point in time, and I think it's very beneficial for patients. Going back a little bit in regards to the hemodialysis at home, there's the traditional, which is, again, 3 times weekly at home for 4 hours. But we're pushing more what we call short daily dialysis. We know that the normal kidney works 168 hours in a week. If you're doing it 3 times a week for 4 hours, you're only getting 12 hours clean. If you do a short daily, 6 days a week, 3 to 4 hours, you're going to get much more clean, and that's better overall for the body. The important things necessary is good vascular access, a good fistula, and oftentimes with home hemodialysis, you need a dialysis partner. Once you're on the machine, it's maybe necessary for them to bring you certain things from around the hospital. What about peritoneal dialysis? CAPD has been around a long time. As most of you know, it requires a special catheter placed in your belly. We call that a tape-off catheter. And then you insert a special fluid, it's usually a sugar solution with certain electrolytes, into your abdominal cavity. And it's the lining of the abdominal cavity, or the peritoneum, that allows the shift of the toxins and the fluids into the abdominal cavity, and you drain that out over a certain period of time. We call that process of putting fluid in and out in exchange. The nice thing about peritoneal dialysis is you don't always need a hook. I have a number of patients that are widowers, and they're doing it on their own. They're doing very, very well, and they like it. The other nice thing is if you have a phobia to needles, you don't need needles. This is a very simple technique, and I often tell my patients that if you can remove the top of a pen and put it back on, you can do peritoneal dialysis. I think it's a very good modality. The two main types, CAPD, usually 4 exchanges in a day. And how would that work if you wanted to work? Well, I tell my patients usually you're going to do an exchange at breakfast, one at lunchtime, one at supper time, and one at bedtime. So you could certainly, if you work daytime, do the first exchange before you go to work. You certainly have to try and coordinate with your employer an area at work to try and do the noontime exchange, but that's very possible. And then the other 2 can be done when you come at home, when you come home from work in the evening and then at bedtime. Automated peritoneal dialysis, or what we call cycle dialysis, utilizes a machine to cycle that dialysate fluid through your abdominal certainly it was great for kids, children who needed to go to school during the day. They could do dialysis through the night. It's great certainly for older students, college students that do this. And then certainly for those of you that want to stay in the workforce. This is great because you can do the peritoneal dialysis through the evening time when you're sleeping, and when you're off during the day to go back to work, which you should choose. I've had a number of patients that realize this. This is just a picture depicting that. The patient sleeping on the dresser there is what we call the cycler machine. It cycles the fluid through the abdominal cavity while you're sleeping, and on the floor is the bag that collects the fluid as it's turned out. This is an actual picture of the machine. It's not very big. It's very compact. It doesn't take up a lot of space. So in summary, if having a career adds joy and fulfillment to your life, there really is no need to stop work and or travel when you're on dialysis for end-stage renal disease. It's important to know your rights and your responsibilities, to work with a nephrologist and the dialysis team, as well as the provider to choose the right modality for you, and also to work with your employer and your supervisors so they know what's going on with you. And it's always important to ask questions